Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. It's so good to see you. Today, we're going to be talking about arthritis, osteoarthritis, rheumatoid arthritis, those two things. So, first of all, thank you to all of our channel members. We've got over 230. It's really, I appreciate you trusting us with that to help you prepare for your Nclex. That's the purpose of this channel, to help you prepare for your Nclex as well as advertise the Clinic Reviews, which are the very best Nclex review out there in the business, in my opinion. You can find out more about Clinic Reviews at clinicreviews.com. And you can also find some of the small group tutoring that I do, as well as Mark Klimek does. If you're interested in paying us for something, that's something you can do there. So let's not waste any more time. Let's go right into our questions. All right, this is osteoarthritis, rheumatoid arthritis, not osteoporosis. Osteoporosis is a weakening of the bone. Osteoarthritis is a degeneration of the space between the bones, okay? Joints is what the space between the bones is called. Hello, Sharon. Do you know what that's called? Yes, I do. Thank you very much. The nurse is developing a teaching plan for a client diagnosed with osteoarthritis. The nurse includes which instruction in the teaching plan? Y'all, you're going to get a lot of teaching questions on the Nclex because teaching is considered the most difficult skill that registered nurses do. So we never delegate teaching to anybody else. We always do the teaching. And the Nclex wants to know if we can practice at the top of our nursing license. So they ask teaching questions. All right, teaching a client diagnosed with osteoarthritis. Begin a running program. Take up knitting to slow down joint degeneration. Eat at least 2 cups of yogurt per day or wear supportive shoes. All right, so this is generally a teaching plan for someone with osteoarthritis. And what do we know about osteoarthritis? We know it's a degeneration of the joints. And it's often a result of trauma to those joints. So trauma could be, and it doesn't mean like acute trauma, right? It's more chronic trauma or long-term trauma, like someone who's been involved in sports. Someone puts a lot of pressure on those joints all the time. Maybe they have a job where they stand all the time. Maybe they were a football player, U.S. football player, something that did some damage to the joints. So what are we going to include in the teaching? Begin a running program. Well, I don't want to put more pressure on the joints if they have osteoarthritis. So running program doesn't sound like a good idea. Take up knitting to slow down joint degeneration. Knitting. Well, knitting isn't putting pressure on the joints, but it doesn't slow down joint degeneration. The degeneration has already occurred or maybe continuing to occur as people age. But it doesn't slow it down. I can't think of any reason why that would happen. Eat at least 2 cups of yogurt per day. All right. So I like the yogurt if this was osteoporosis, right? Because that would have calcium in it. But this is not osteoporosis. This is osteoarthritis. Wear supportive shoes. Well, I know people with osteoarthritis have pain in their joints. And one of the ways to limit some of the pain in the joints is to wear the appropriate shoes. That's pretty fundamental. You get good shoes with good arch support, that has good cushioning so that you're putting less pressure on those joints. And the good cushioning in the shoes is taking some of the pressure from walking. So that seems like a good idea to me. Okay. So again, we're using our common sense, but we have to know what these words mean. We have to know osteoarthritis is not osteoporosis. Which element is a risk factor for osteoarthritis? A thin build, obesity, a non-smoker, or male? Okay, element is a risk factor. So osteoarthritis, again, is damage to the joints from trauma, from standing too much on it over time, from sports injuries, that kind of thing. So a thin build, is there anything about being thin that would increase your risk for osteoarthritis? Now, thin build could increase your risk for osteoporosis, y'all, but this is not osteoporosis, this is osteoarthritis. Obesity. Well, obesity would cause there to be a greater weight on the joints when you're standing. So obesity, I could see how that could be a risk factor. A non-smoker, okay? A non-smoker isn't a risk for anything. Male. A female would be at risk for osteoporosis, but I can't think that a male would be more at risk for osteoarthritis. I mean, if it said he had a history of football injuries chronically over a 20-year period, then I would say, well, yes, but that doesn't say that. It's just gender, right? Just gender. So the only one here that makes any sense for putting pressure on the joints would be obesity. 3, a client diagnosed with rheumatoid arthritis is started on methotrexate. Which statement made by the client indicates to the nurse that further teaching is needed regarding drug therapy? Drinking alcoholic beverages should be avoided. The healthcare provider should be notified 3 months before a planned pregnancy. Any side effect of this drug will be mild. I will avoid any live vaccines. All right, so osteoarthritis is degeneration of the joints from overuse, pressure, trauma. But rheumatoid arthritis is a autoimmune disorder that causes degeneration of the joints from this autoimmune disorder. Now, autoimmune means your immune system is attacking itself. And so, what we do for autoimmune disorders is we give medications that suppress the immune system. So, whether you know much about osteoarthritis or not, you should know it's an autoimmune disorder. So, if I'm giving them a drug, most likely the drug I'm giving to someone with rheumatoid arthritis is a immune suppressant. We're talking, let's think generally with that way, okay? So which statement indicates further teaching? So which is a false statement? I always remember further equals false. F and F go together. Drinking alcoholic beverages should be avoided. Well, that's a true statement. That's a true statement. That's always a true statement. I always tell people to avoid alcohol when they're starting out on new medications. So yeah, avoid alcohol. Healthcare provider should be notified 3 months before planned pregnancy. Well, that seems like a good idea. I don't know that that's the exact amount of time, but it certainly seems like a good idea. If you're taking an immune suppressant, someone's planning to get pregnant, I would say at least 3 months. So that seems like a good idea. Any side effects of this drug will be mild. Well, we're giving them an immune suppressant. I can't imagine suppressing the immune system is going to result in mild side effects. So let me keep going with that. I will avoid any live vaccines. Well, if I'm suppressing the immune system, it seems like a live vaccine would put them at some risk if their immune system is suppressed. So it just makes sense to me that taking an immune suppressant would contraindicate live vaccines, that I wouldn't want to take an immune suppressant when I'm pregnant, and I wouldn't want to drink alcohol. So none of those make any sense. So any side effects of this drug will be mild seems like the false statement to me. Question 4. The nurse is caring for an older, alert adult client diagnosed with osteoarthritis. Which client statement indicates to the nurse that the client is using effective coping strategies? Effective coping strategies. I do not know how long my wife will be able to take care of me at home. The bus is coming to pick me up from the senior center 3 times a week so I can play cards. I am helping with the dishes and laundry, but I hurt so badly when I am doing it. I do not know how much longer my neighbor can continue to help clean my house. The nurse is caring for an older, alert adult client diagnosed with osteoarthritis. Which client statement indicates to the nurse that the client is using effective coping strategies? So we have to know what coping strategies are. Coping strategies are something that we do to problem solve something that's a change, right? And how do I cope with that? Do I just complain about it, or do I take action to deal with this change in a way that is effective and healthy? Okay, so that's what coping is. So I do not know how long my wife will be able to take care of me at home. That's a problem, but that's not a coping strategy. That's just identifying the problem, not coping with it. The bus is coming to pick me up from the senior center 3 times a week so I can play cards. So I don't know how that's related to osteoarthritis, but it is a coping strategy. If I'm older and I want to go play cards, and the bus would be one way for me to get there. I mean, that's a coping strategy for me to get to the senior center. I don't know how it's related to osteoarthritis, but we'll leave it on the list because it is a coping strategy. I am helping with the dishes and laundry, but I hurt so badly when I am doing it. Okay, so that's a problem, right? I'm helping with them, but it's really hurting me. So that's just identifying a problem, not coping. I do not know how much longer my neighbor can continue to help clean my house. Again, that's a problem, not a coping strategy. So even though I don't know how B relates to osteoarthritis specifically, it is a it is a statement of coping. This is what I'm doing in order to achieve my goal. So apparently the goal is to play cards, and I'm getting the bus to get there to do that. I included this one here just so that you can see how you can read a question. And even if you're like, I don't know what this question is asking, but I do know what a coping method is or a coping strategy is. So I'm going to pick the answer that demonstrates that I know what a coping strategy is. All right, 5. Before administering prednisone IV push to a middle-aged adult with rheumatoid arthritis, the nurse notes that the client's random blood glucose level is 139. Which action is most important for the nurse to take? Prednisone does suppress the immune system, but it also causes hyperglycemia. So a side effect of prednisone is hyperglycemia in some patients. Not everybody has that, but it's pretty common. So it's a side effect. Is it a side effect? Well, is it an adverse effect? An adverse effect is something that causes us to stop using the medication. Call a doctor, stop using the medication. So hyperglycemia is not an adverse effect. It's a side effect, which means we have to manage it, but it doesn't necessarily stop us from using the medication. So because they do need to take in something that suppresses the immune system. So in this case, we're using prednisone. All right. So which action is most important? So this is a best nursing action question. Best nursing action means you can only do one thing. This is not a first question, y'all. It's best. Best means I can only do one thing. So if I can only do one thing, what's the one thing that I have to do? Instruct the client to drink diet soda to prevent the elevation of blood sugar. Okay. Administer the prescribed prednisone on schedule. Notify the healthcare provider of the random blood glucose result. Review the client's ANA level. So the one that I feel really comfortable crossing off is D as in dog. Review the client's anti-nuclear antibody level. That doesn't seem related to this question specifically. I mean, I may want to do it, but it doesn't seem like the most important thing to do. And then the other one I feel comfortable crossing off is A. I may want to advise them to drink diet soda, but the reason their blood sugar is high is because they're taking prednisone. So I'm not sure that drinking diet soda would really help because it's a prednisone problem, not a soda problem. So I feel comfortable crossing off A and D. So if I can only do one thing, would I want to administer the prescribed prednisone on schedule, but not notify the healthcare provider of this glucose level? Or should I notify the healthcare provider, but not administer the prednisone? When I say it like that, that makes it more clear to me what I should do. I have to give the prednisone. They have an autoimmune disorder, and this is an immune suppressant. This is the treatment for the rheumatoid arthritis. And the elevated blood sugar is expected. So I don't have to notify the healthcare provider about that. Now, if it said it was 650, that would be a different question. But this does require a certain amount of clinical reasoning. So not only do you have to say which one is most important, but is this blood sugar of 139 serious enough that I have to call the healthcare provider? And it's not high enough that I have to call the healthcare provider. If their blood sugar was 600, y'all, I would have to call the healthcare provider about that. I'd have to, but not for a blood sugar of 139. And because this is the drug that's treating the rheumatoid arthritis, I have to give it, considering that the side effect is not that bad. 6, the nurse is reviewing the medication history for a client diagnosed with rheumatoid arthritis who has been ordered to start sulfasalazine therapy. The nurse plans to contact the healthcare provider if the client has which condition: glaucoma, hypertension, hypothyroidism, sulfa allergy. Okay, the nurse is reviewing the medication history for RA. They're supposed to start on sulfasalazine. Which one do I have to contact the healthcare provider about? You may not know this, and that's okay if you don't, but there are some decent guessing strategies. One guessing strategy is what we call the Sesame Street rule, or it says which of these is not like the others, which one just doesn't belong. So we've got a disease in A, a disease in B, and a disease in C, and then an allergy in D. So that's the only one that's not like the others. So you could use the Sesame Street rule here if you wanted to. That would work. Or you could say, well, sulfa allergy versus sulfasalazine. Sulfa allergy for sulfasalazine. So if you're just purely guessing, y'all, the answer that has sulfa in it for a drug that's called sulfasalazine is a really good guess. So I just wanted to put this on here. Not every time, not every drug question that you get, you're like, well, I don't know what the drug is. Okay, fine. How do I guess? There's a different number of different strategies. You can go, well, which one is not like the other ones? Disease, allergy. And this is a med question. I'm concerned about allergies. Or sulfa. Those are two things you could use to get this one right. The nurse is caring for a patient with rheumatoid arthritis who's taking Naproxen twice a day to reduce inflammation and joint pain. Which symptom is most important to communicate to the healthcare provider? Joint pain, worse in the morning, dry eyes bilaterally, round and movable nodules under the skin, or dark colored stools. So whenever they give you one patient with the disease is in the question, it's rheumatoid arthritis. And then they say which of the following symptoms is most important to communicate, or which are you the ones are you most concerned about, or which required immediate intervention. You say, well, I'm going to be most concerned about the unexpected finding. I'm going to call the doctor about the unexpected finding. So they've got rheumatoid arthritis, right? So which one of these is unexpected? Joint pain worse in the morning. Actually, that's expected with rheumatoid arthritis. Dry eyes bilaterally. That may be expected. Even if it's not expected, dry eyes is not a big deal. So to me, that's not something you call the doctor about. C, round and movable nodules under the skin. And I go, well, that's expected with rheumatoid arthritis. D, dark colored stools. Well, dark colored stools is not expected. Dark colored stools usually indicates bleeding, and they're taking Naproxen, which is anti-inflammatory and can cause gastric irritation, which can cause bleeding. So what you don't say is, well, dark colored stools would be normal when you're taking Naproxen. No, it wouldn't. The disease is rheumatoid arthritis. We're looking for things that are expected with rheumatoid arthritis, not things that could happen with Naproxen, because this is an unexpected. We don't want someone to have dark colored stools when they start taking Naproxen sodium. Even if you say, well, it could cause gastric irritation. That's right, it could, but that's an adverse effect, y'all, not a side effect. That's an adverse effect, which means we have to stop taking the medication if that happens. Side effects, you teach the patient about them and how to manage them. Adverse effects, you stop the medication and call the healthcare provider. That's the difference between side effects and adverse effects. I know it doesn't say adverse effects. What I'm telling you is, how do you interpret the difference between a side effect and an adverse effect? Initiation of subcutaneous etanercept for a patient with rheumatoid arthritis is being considered. Which patient information is most important for the nurse to communicate with the healthcare provider? The patient is currently taking methotrexate. The patient has a positive tuberculin skin test. The patient has had type 2 diabetes for 5 years. The patient is anxious about having to self-inject. All right, so when you get asked about a medication, and then they say, what would you assess for before starting this new medication? What would you assess for before starting a new medication? You're always assessing for contraindications for that med. Contraindications for the med. So when it says, what is the most important information to tell the healthcare provider, you tell them if you discovered any contraindications for taking that medication. So they're rheumatoid arthritis, so they're going to be taking some kind of a immune suppressant, and it's being considered to start them on etanercept. It's being considered. They're not necessarily starting them on it, but they're considering it. So we're looking for contraindications. So taking another immune suppressant, is that a contraindication? Methotrexate? Well, no, it's not. They'll have to switch it off, and I don't know if they can take them together or not, but that's up to the doctor about whether they're going to how they're going to switch that out. They have a positive TB test. Well, they could have an infection, y'all. If they have a TB infection, is having an active infection a contraindication to taking an immunosuppressant? Yes, it is. Yes, it is. A current infection is a contraindication. And you may say, well, we don't know for sure they have that they're positive for TB. We just know they were exposed. Yeah, you're right. We don't know. So we got to tell the doctor so they can order the right tests, because we don't know if they do. Patient has had type 2 diabetes for 5 years. Is that a contraindication for taking immunosuppressant? No, it's not. No, it's not. If the patient is anxious about having to self-inject, is that a contraindication? No, it's not. It's not a contraindication. So the only one that's an absolute contraindication is if they have an active infection to taking immunosuppressant. And you are allowed, I mean, if you don't know what etanercept is, and look, I don't know anything about etanercept. I'm not a rheumatoid arthritis specialist at all. This is how I answer questions when I'm not a specialist in an area. I don't try to learn everything there is to know about these meds. What I say is, what do I know? And how can I answer the questions based on what I do know about these things? So I hope that was helpful. Hope you have a great rest of your day. And I'll see you later. Bye.